My name is Merin Kinikini, and I am a nurse practitioner and a registered dietitian. Really, if we think about the liver as the front line, it's the frontline organ that gets basically everything we breathe, everything we eat. It has to process it, it has to be able to discern if it's important or not, and if it's not, how to get rid of it, because the things that are harmful to us or just aren't needed, our body wants to dispose of. Healthy food and beverage choices for a liver cancer patient. Oftentimes that's challenging because the liver cancer patient can be more nauseated and just have a lot of side effects. Oftentimes patients are told, it doesn't matter what you eat, just eat calories. And I have to disagree. I feel like it does matter what you eat. It always matters what you eat. And you need to focus on calories when you're not eating as much, but it should be overwhelmingly healthy calories to benefit you the most. What we found over time, and especially with epidemiological studies, is that diets rich in phytonutrients. So diets rich in vegetables, colorful vegetables, rich in fruits, especially if, again, they're colorful fruits, in a balance. And then if grains, whole grains, beans, kind of like a Mediterranean type diet that we hear about, it seems to be the most protective to not only our liver, but to the rest of our organs. Still focus on the fruits, vegetables, grains, and then if someone is struggling to get calories, then we just power pack those same foods. So we might do more ground nut butters, we might add more olive oil to our soups, sometimes even a little cream to the soups. And avocado works really well as in smoothies or as to eat for some extra calories. So the goal is to still eat a good diet and a healthy diet, but just maybe you need more condensed calories during that time. If someone has insulin resistance or they have problems with metabolizing sugar, then they're probably going to do a lower carbohydrate ratio and maybe a little more protein. And then when you talk about fat in general, you're trying to get more monounsaturated or polyunsaturated fats like fish oils, olive oils, your nut butters versus saturated fats, which tend to be, more processed types of fats. They're solid at room temperature, and they tend to be pretty prevalent in processed food. Drinking the proper amount of water was the question, and it varies with everyone. I mean, they generally say 8 glasses of water a day. I base it on how well you feel, if you're not getting headaches, you're not getting sort of side effects, and is your urine output, light colored. Sometimes if you have liver disease, you can't rely on your urine because it tends to change color based on your bilirubin level. But it's really just at least 6 to 8 glasses in general. If you're eating a lot of vegetables and fruits and things that have water in them, then you might need quite as much, especially if you're nauseated or you're not able to take in as much liquid, without feeling full. But in general, it's about 6 to 8 ounces a day, 8 glasses of water a day. Hydration as a whole can include other items too, so it doesn't just have to come from water. Things that are high in water content, so coffee, electrolyte replacement drinks, green teas, all those things that can be really good for you, you can include as part of your water needs for the day. And then if you need to add calories, you can add healthy kinds of fats and milks and things into those beverages to add extra calories. But I would not recommend soda as a beverage. Having liver cancer can affect your appetite by making you more full, more nauseated. If the liver's not processing things appropriately, you do get a lot of nausea. You can get ascites, so your belly grows and you just, when you eat, it feels like you're eating a huge meal when you're just eating a few bites. And so again, that's when you're trying to make use of the concentrated, healthy items like the avocados and the nut butters and certain beverages. Maybe you're making smoothies or things that have higher calories in them, you're adding fats. And then there are supplements out there that patients can use. I mean, there's even just the standard supplements that are high protein tend to be reasonably good for a patient. And then they also have plant-based options if patients are gravitating more toward that lifestyle. Supplements such as oral nutrition supplements. So they have protein in them. There's some sort of milk base, so they're soy or milk type based. They usually have somewhere between 250 and 400 calories per bottle, which is around 8 to 11 ounces. And so once in a while, obviously, if patients are they can't really eat food, they're just feeling really full, using those oral nutrition supplements can replace a meal, or they can use them in smoothies or in soups or in a lot of different ways to get more calories and protein. I hate to say all or none with anything, but trying to minimize is what I call the SAD diet, or the standard American diet. So it's a lot of processed foods, it's sugar, because sugar can increase insulin and insulin resistance and cause more inflammation. Unhealthy fats, although we sometimes don't use that as much, like if someone needs a little cream or a little bit of butter when they're struggling, then that's the less problematic of the choices, but definitely a lot of high sugar, highly processed food. It's really hard for the liver to get through. It's hard for the liver to break down, and it's increases inflammation. Things that have a lot of ingredients. So things that you read the ingredient label and you have no idea what it says. It's processed breads or processed desserts is a big one. So donuts and cupcakes and all the stuff that's processed. If someone's not used to eating sort of a Mediterranean type diet or a more healthy diet, they're used to eating the standard American diet, and then you say, well, eat this way, to help yourself and your liver, it can be really overwhelming. And so oftentimes what I've done, which I think is helpful, is rather than take away something, I just ask them to add something. So it's like, just add a vegetable. Just add, a serving of vegetable to each meal. And we work toward that over time. Like maybe it's 1 serving a day, and then it's 2, and then 3. And the goal is 7 to 9 servings a day of vegetables, mostly vegetables, some fruit. And so it's just, instead of them feeling like they're removing all these things from their diet, they can't have this, they can't have that. It's like, let's just add these things instead. And then oftentimes when they're adding these things, they're kind of full, and it's easier to take away the other stuff that they're used to. But it kind of has to be done in a stepwise approach, and nobody does well with this huge change unless they're really motivated and they want to do it 100%. But even then, it's life gets in the way. So it's trying to be realistic with the patient. I think it's just being able to focus on a day at a time. And the ways that you're going to get through that is day to day, you're going to eat as best as you can, and these are the ways we're going to do that. You're going to manage your nausea, you're going to manage your GI problems. Sometimes it's constipation, it's diarrhea, like whatever it is that the patient's experiencing, it's trying to have them see short term but also long term and keep that hope going. From my personal experience with my own family members that have gone through liver transplant, and through my patient and the experiences, I think, having the optimistic mindset, saying, absolutely, this is worth fighting for. My life is worth fighting for. My goals are worth fighting for. And it's one step at a time. The control I have, I will take. So I have control over my nutrition. I have control over getting to my appointments. I have control over how I feel, as far as how I want to get through this illness. And I think reaching out to to get help. I've obviously loved ones, even healthcare providers, giving more tools if you don't feel like you don't have them yourself. Because a lot of people go through this journey. It's worth it. I mean, it's worth doing. So I think it's just finding the tools that work for each person to keep them positive.